Ani, bonjour, welcome everyone to the second installment of CROSH COVID Conversations. My name is Tobi Mankis and I'm the Science Communication Officer at CROSH, the Center for Research in Occupational Safety and Health. We're streaming live from the CROSH lab at Laurentian University. We acknowledge the Robinson-Huron Treaty of 1850 and recognize that Laurentian University is located on the traditional lands of the Tikmashing Anishinaabeg. The city of Greater Sudbury also includes the traditional lands of Wanapitei First Nation. CROSH COVID Conversations is a 5-part webinar series on the intersection of occupational safety and health and COVID-19. Our panelists will speak for 15 minutes each, and then we'll have 10 minutes of audience questions. You can enter your questions at any time in the chat function of the platform you're watching this on. I'll then ask your audience questions to our panelists during the Q&A section. Today, our topic is managing the flow in the workplace, and our panelists are Judit Nelson and Dr. Thomas Merritt. Our first panelist is Judit Nelson. Judit is an industrial hygiene specialist at Workplace Safety North and is on a mission to improve workers' health and safety by focusing on long-term exposure-related issues. She specializes in dust and other airborne hazard controls in industrial establishments. Prior to this, Judit contributed significantly to a large project on dust control and mitigation measures. Judit has extensive experience in industrial and confined space ventilation, which assists her in her goal to improve environment conditions in the workplace. Thank you for joining us today, Judit.
Good day, everyone. Thank you for the great introduction. So today, I really like to focus on just talk about mostly about the airborne and aerosol contamination in a work environment. Specifically, I'm going to talk about it relating to biological agents like, for example, COVID-19 or bacteriums. So before I really get into a ventilation section of it, I just want to really highlight the route of transmission of this virus traveling or introducing the environment. So the first one is we usually talk about a lot is via contact. So this is where you pick it up from an object. So a good example, for example, if a mother takes a bite of an apple and gives an apple to his daughter or son and bites from the same object. So you transporting that mucus, that saliva over to the individual. The droplet, we're talking about the droplet transmission. When we have large droplets, it's literally propelled or like almost like a ballistic way is thrown into our face and enters our mucus and your eye area. And that's how you inhale those droplets, and that's how you pick it up. And primarily when we, the recommendation for wearing the face mask, it's against those larger droplets when they became airborne. So that's happened when somebody, for example, coughing or sneezing. When you look at airborne waste transmission, the droplets is inhaled usually from the far away from the infectious person. So the droplets are small enough that they are actually transported via to their work environment or living environment via air current. And they usually attach themselves to, for example, dust particulates that it flows in the air. We also look at the aerosol transmission, which is those are usually it's occurring when the person or the source is close contact. Mean close contact that I'm talking to somebody and I'm very close, and as I'm talking, this very, very tiny viral material exits my mouth, my nose area, and enters your breathing zone area. So that's the 4 ways we look at it when we're transporting the material or a virus in the air. And I just want to make a note on that originally from a Center for Disease Control and Prevention, they indicated that most likely airborne contamination is not very important, but I don't know if you had a chance to look at the news, but a few days ago, they actually updated the guideline about airborne transmission, and they actually mentioning that on their website and inform people about it. So aerosol is also a very important mode of transmission that probably we didn't give enough attention to it, but I think it's real coming as we learn more about the virus. So when we look at the seriousness, I guess, about how infectious is a virus or other contamination or biological contamination, we usually look at what is a half-life of that virus or bacterium. What does half-life mean is that you have half of that, 50% of that virus is actually dies after a certain amount of times. So the half-life right now, what I could see, they're talking about 2 to 3 hours for COVID-19 virus. They say it's half-life. And the reason we look at that, because when we developing controls, for example, it's important to know that how long these viruses are viable in the air or in surfaces. And that's how we would drive our controls, how efficiently we need to have the controls for that. Now, most controls right now focusing about screening. For example, if you go to a workplace, you would have a questionnaire and people fill it out and see if they have any signs and symptoms of the virus. Another very prominent control is surface cleaning. In my opinion, it's a little bit, what I see in workplaces is a little bit too much. And the reason being that because the chemicals that they're using are actually very harsh and it could cause secondary problems with the people who's exposed to it. So with this conversation, I really like to focus on about the air quality around us and possibly, reduce the risk to catching the virus by looking at particulates traveling through the air and how we are interacting with it and what's our chance to actually catching it from longer distances. So generally, when we're looking at any airborne contamination, and whether it's chemical agent or biological agent, we're usually looking at two key factors. The two key factors is when we're looking at the concentration levels in the environment around you or the duration of the exposure. So for example, I'm in this 1 square meter area, how many particulates, viruses are floating around me? The numbers, if there is larger numbers of particulates and air virals are floating around me, the concentration levels are higher. If I'm standing in this place, for example, 2-3 hours, whether I'm working on another place 8 hours, it's also going to increase or decrease your exposure level. If somebody working part-time in an office area and stays there 4 hours, her exposure or his exposure would be significantly lower than if somebody would be working the air 8 or 10 hours a day. So there is some controls we could implement, and some of those ventilation controls, I'm just going to go through with it. For example, we could look at local exhaust ventilation. When we're talking about local exhaust ventilations, basically the ventilation is usually set up for that one room, one shop area to keep the air quality clean. So a very good example for that, if we have a mechanical shop, for example, workers are working in there and there is a local ventilation system is installed in there to bring out the contaminated air away from the workers while they're working, because the mechanics using lots of chemicals and sometimes they're doing welding, cutting, and which fume generating in the air. And those fumes are usually fairly hazardous due to metal works. And we want to exchange that, so they would install a local ventilation system. Now, the local ventilation system, for example, in a welding shop would be, let's say, the industrial standard is to exchange the air in that one welding shop 10 times an hour. So what does that mean? And I'm going to talk about room air exchange right now. What does that mean? In that welding shop, when the people are working, in that 1 hour period, I want to remove the entire volume of air in that 1 hour 10 times to reduce the exposure levels or concentration levels on the workers. And for example, this is for a welding shop. For example, in regular households or office areas, the standard is usually 2 to 3 times of exchange rate. So every hour, I'm exchanging the entire volume of air 2 to 3 times an hour. And it's when we're looking at room exchange rates and hourly, what we would like to do is increase that number to a level where we could drop down the concentration of contaminations inside the work environment or living environment. Right now, what I could see, what they're recommending, for example, for COVID, is 6 exchange per hour. So in that room, I would have to remove the whole volume of air 6 times to keep that. And that would keep the viral content of that room low enough that the people would have less chance to expose the COVID virus to that level that they actually get sick from it. We also have some barriers that some people using. So the barriers has positive and negative effect to it. So for example, if I have a room and I start building barriers in that room, what's happening? The natural airflow was, for example, coming through the room. You're actually disturbing that airflow. So the air flows through and bounces into a barrier. What's going to happen? Or if you have barriers, it's going to create like a bubble around it. It's almost like a shadow bubble where there's not going to be too much air movements happening. It will be increases some airflow around it, but in that one area, it's not going to have exchange rates. So if you have many of these objects in a room, these barriers, these isolators, partial barriers, isolators, you're actually disrupting the natural airflow in the room or work environment. And it could have negative effect when we're trying to change the air, the room air out. I mean, on the positive side, if you have a completely barrier or isolation, then you would have each individual person would be completely isolated. And ideally, you would have individual exhaust system coming off from that barrier area. That doesn't happen. Usually you could see that, for example, some booths in some industries has it just to protect the workers, but most likely would be partial barriers. And just keep in mind that these barriers, if it's partial barriers, is only protect the worker or only protect the other people from people when they're sneezing or having these large droplets stop by these barriers, because truly the really fine particulates could float in the air for hours and hours and they will dissipate in the air. Portable air cleaners, you probably see some portable air cleaners. If you go, I don't know if you went into lately to a dental office or offices, doctor's offices, portable air cleaners are commonly used. Those are smaller units. And the way they're working, they have a filtration system in there. So they have a HEPA filter, most likely a high efficient particulate filter in there. And the air would flow through. Those HEPA filters or would pick up the particulates. And then the clean air would come out in the back end or on the side. They also have some combination where they have the filter plus the blue light to clean the air. But they are very, very effective. Now, they usually don't make these portable filter air cleaners in large unit. What I see out in the market right now runs from 100 CFM air volume to probably about 10,000 CFM. So that all depends what you're using it. You could adjust that for your needs. We also have those general ventilation system. With the general ventilation system, that's most likely you see at all the larger companies and schools. So if they take the air from outside, they bring it through the building and they exit out the air on the other side. So again, that helps with an exchange of the air in the rooms and common areas. And they're very effective. If you could increase the efficiency of those systems, especially now, they work very well. Another way to increase it, because really, when we're looking at air condition and ventilation system, they usually on average run about 25% over the day. So what you would do, you would increase the fan. You could actually bypass that process and have the fan running 24/7 Therefore, the air exchange is continuous and it's going on. Lots of companies have both. They have portable air cleaners now in the training rooms, for example, and the general ventilation systems. So you could use it as a combination too, and again, it's very effective. One key information I just want to provide that before you do any of these upgrades, it's important for you to know actually what's happening with your ventilation system. So I would right away start just with an evaluation. Let's take a look, what type of filters we have. Are the fans, are they even missing a blade maybe? Do we have actually physical damage to our duct system? So a good assessment and see if actually the unit what you have in a building is actually providing the air what actually it's stated on the instruction and menu specifications. And for last, the most effective way, if I could recommend everybody, open up the windows 2 to 3 inch in the rooms if you can, even in the winter. My mother used to do it with me. And let the air come in, and then what you're doing, you're diluting the contamination in the room, and you're increasing the rate of air exchange. So a simple 2 to 3 inch, opening the windows, opening doors, so you have a cross breeze. It goes a long way when you are trying to reduce the exposure levels on individuals. Thank you.
Thank you very much, Judith. That was fascinating, and I know we'll have several questions for you and the question and answer. So thank you very much for sharing your expertise with ventilation and how that works in terms of COVID-19. Very fascinating. Our next speaker is Dr. Thomas Merritt. Dr. Merritt is a full professor in the Department of Chemistry and Biochemistry here at Laurentian University. His research combines bioinformatics, functional genomics, and experimentation to explore the connection between genetic diversity and biological complexity. A past Canada Research Chair in Genomics and Bioinformatics, Thomas was trained as an evolutionary biologist and expanded into experimental studies of enzymes, metabolism, and stress biology as a postdoc and in starting his own lab. Research in his group often focuses on metabolism, stress, and genetic networks using the fruit fly model system in the laboratory. But projects also include a wide variety of organisms, locations, and biological questions. Thank you for joining us today, Dr. Merritt.
Thanks, Toby. Thanks for the introduction. I think that's going to leave a lot of people wondering exactly what I'm doing with COVID-19. Perhaps a question that I'm asking myself on occasion. So let's look at the other end of this system. So Judith gave us a really interesting discussion of what happens when COVID-19 is potentially in the air. And what we're trying to do there, if I understand correctly, is increase airflow to the point where we're limiting the prospects of somebody picking up that virus and sort of continuing that infection cycle. One of the big things in the pandemic at the moment is we really don't know who is and who is not infected. And I think the numbers are pretty frightening. It's something like greater than 40% of the people that end up with this virus show limited or no symptoms. And so we have these asymptomatic carriers that are out there that are potentially, especially if they're in areas that have limited airflow, potentially spreading that virus. So there's a lot of interest in trying to understand who is and who is not infected, and how do we actually sample and look at the population. And so currently I think if you're watching the news, there are a lot of issues with the sampling at the provincial level. We have more people being tested than we have capability to run those tests through. There's a big backlog of tests. The upside of testing individuals is that we know whether that individual is infected. The downside is you have to see that individual. So somebody has to come in or you have to go to them. So there's a lot of push to say, well, how do we sample test more broadly? And one of the ways it's come out in the last maybe month or so, a little bit longer than that, is we can look beyond the individual. And so the project that we're working on is to use wastewater to look for the virus essentially environmentally. And so we've got a NSERC Alliance funded project. So NSERC, the Natural Sciences Engineering Research Council, one of the things that they do is they fund basic fundamental research, like the things that we do in my lab, but they also do a lot of applied research. And so this is an applied project where I'm working with a bioinformatician at Health Sciences North Research Institute, Gustavo Ipazeta, and Michael Loken, who is head of wastewater management at the city of Sudbury. And the three of us are working together to use wastewater to look for the virus. So it's a straightforward project. You collect wastewater, you sample that wastewater, and you look for the presence of virus. And what we can actually do is quantify the amount of virus or viral genetic material. In this case, it's RNA. You can quantify the amount of genetic material that's in that sample. And what it will tell you is the prevalence of infection in that community. And so then we can start looking at a community level response. And there's a lot of push at the moment, a lot of concern at the moment. There's a lot of infection in Southern Ontario. There's not as much infection in Northern Ontario. What does that mean? How should we be behaving? Well, the problem is we really don't know how much infection is here. We know people that are symptomatic, and that's about it. And if you're going in and getting tested without being symptomatic. So we could use this wastewater survey to get a better idea of whether the community is experiencing infection at a lower level and of whether that's increasing. You can actually survey through time and look for an increase. So realistically, it's the idea of broad survey of a community to look for infection. We've got the upside of doing a broad survey, the downside of not having individuals, but you can give an idea of whether that community should be concerned. It's an interesting project for a couple of reasons. One, it's new and novel. We don't have this technology, or we haven't had this technology. And then two, there's some interesting places that we could go with the project next. So we can talk a little bit about the nuts and bolts of how this works. So as you can imagine, the first thing we have to do is sample wastewater. And so you can do that at any sort of wastewater collection facility. And sort of an interesting aside, and Tobi, maybe we can come back to this in the Q&A, individual universities have started to use this to look for prevalence of infection in that particular section. So our project at the moment is to use central wastewater facilities in Sudbury. I think there are about 12 facilities across Greater Sudbury, and each of those has a catchment, right? And so as we survey in a catchment, we could say this area does or does not have evidence of infection, and then we can actually quantify it and say we have these areas that are really highly infected or less highly infected. And then you take the wastewater. And the virus that we're dealing with, the SARS-CoV-2, is an RNA virus. So the genetic material, the information in that virus is RNA. Take the wastewater, we can actually sample out the RNA in a really straightforward fashion. And then what's done at the moment is you can use what's called quantitative PCR. And so that takes the RNA, it amplifies it through a couple of steps, and it says, is that virus present? And it's exactly the same test you do with an individual. So when you do a nasal swab, you're isolating the genetic material from that individual, looking for viral genetic information in that sample. Now the sample is wastewater instead of mucosa from the nasal cavity. So take the water, extract the RNA, and then we can run through and do the straightforward qPCR test. Is virus present or is it absent? And that's really what's being done nationally and internationally at the moment as a way to use wastewater to survey broadly communities. What Gustavo proposed and what we were working on with this particular grant is to take that RNA and then use a novel sequencing technique called nanopore sequencing to sequence it directly. And on some level, nanopore sequencing is cool just because it's amazing. So it's a technology that when I was a grad student was science fiction. You take the RNA and you run individual strands of the genetic material through a membrane, through pores in the membrane that are actually receptors in the cell. So just incredibly tiny things where a single strand of nucleotide runs through that membrane. And you read the electrical current across that membrane as this genetic material moves through it. It's absolutely science fiction, and it absolutely works. What it allows us to do is not just identify whether the virus is present or absent, which is what the classic tests do, but it actually sequences a virus at that same time. So what does this allow us? One, we can say whether there's virus in the community. Should we be doing, should be extra vigilant with things like social distancing because we know there's infection. Two, we can actually start to see how many different forms of the virus are present in that community. And so we can start to look for variation. We could even say things like, well, given the fact that we've got this variation of the population, we're probably getting infection from the States. We're probably getting infections from Eastern Canada. We're possibly getting infection from Southern Ontario through Toronto. There's enough variation in the virus that we can start potentially teasing that apart. And the sequence data allows us to do that in a way that the current tests don't do. So using this protocol, we can say to the community, infections are on the increase, infections are on the decrease. This is a possible source for the infection. And so it's potentially, it's a really powerful way to survey the community broadly. Great. Where could we go with this technology in the future? One of the really defining characteristics of this type of sequencing is that the sequencer itself is smaller than my cell phone, and it plugs directly into your laptop. And so I sequenced DNA all the time as a graduate student, and the instrument that I worked with was the size of a couple of large file cabinets, sort of side by side and on top of each other. And it would take anywhere from 24 hours to 2.5 weeks to get the results back from that sequencing. What we can do now, take that sample, literally just sort of pipette it into a thing about the size of a cell phone, plug that into the laptop, and directly read that information in real time. So it's quick, also fast, but it's small and incredibly portable. And so potentially we could go into remote communities, sample the wastewater in those remote communities, and tell you in a matter of hours whether you have infection or whether we need to be concerned with spread of infection in those areas. So allowing us to go into areas that are far more remote than we could go in with the current technology and actually survey those areas. So the immediate term use of the technology is to survey municipalities like Sudbury. The future short-term future is that we could go into more isolated areas and survey those directly as well. Where we're looking in the future is the technology is based on sequence. It's based on information. It's based on that genetic material. The genetic material is very similar in any pathogen that we're interested in. So right now, globally, we're fighting COVID-19 or the SARS-CoV virus. Realistically, we're looking at future pandemics. So what is the next pathogen that we're going to be dealing with? As we develop ways to effectively fight this pandemic, we need to be thinking about what's the next step. And something like this sequencing technology is directly applicable to any kind of pathogen that makes it into the wastewater. So we can go back and retool this technique through a simple set of steps to look for the next virus, the next bacteria, the next thing that we're facing as a community. So I mean, fundamentally, it's a really interesting use of novel technology. It allows us to take a standard that we're using now, this quantitative PCR standard, and compare it with a potential novel way to test things in the future. It's going to give us immediate ideas of what the pattern of infection is in a community without necessarily looking at individual by individual by individual sampling. I want to be very clear, it's not meant to replace individual sampling. So as I said before, when we go in and we sample individuals, that tells you whether that individual is positive. And that's going to give you immediate ideas of whether that individual needs medical care, that individual needs to be physically isolated. There's a lot of information in those tests. What this will allow us to do is partner or pair with that to broadly survey communities, literally surveying thousands of people at a time instead of having to go individual by individual by individual. The other reason that this project is really important is it's a very fundamental collaboration between three different institutions that don't necessarily always talk to each other. So we have a hospital, we have a city, and we have an academic institution, the university here at Laurentian. And these kind of projects are really important. And actually, one of the things that CROSH does really well is put together these kind of collaborations. And so I think it says a lot about our federal government that they're really pushing this kind of funding. So without taking away from the funding for fundamental research, they're allowing us to do these kind of projects that allow us to take novel technology that's been developed through fundamental research and then tie that back into an applied question. In this case, something that we're dealing with on a moment-by-moment basis with the pandemic. So why don't I leave it at that? And Tobi, we can go to questions.
That sounds great. Wow. Thank you very much, Thomas. That's absolutely fascinating. Some very, like you say, cutting edge, almost science fiction type work. So we'll now entering kind of into the question phase. And so we've got a lot of really great questions from the audience. And so I'm actually going to start off with Judit. We've got a question for you. And actually, this actually ties back to the American debate last night, and that's like the use of plexiglass. Is it meaningful, say, to have plexiglass in that kind of scenario, or even just like in an office scenario, plexiglass as a divider?
So plexiglass, as I mentioned, that it protects you against for large particulates, droplets. So somebody sneezes, is that barrier is there for you. So the large droplets, particulates are interact with the plastic glass and it stays there, basically. Like when you sneeze in the clear glass, you see all the droplets in there. But it does not protect you against for the fine particulates, which many times, the viruses are very tiny and attaches itself to dust particulates, and they travel and diffuse in the room area. So if you use plastic glass, it's really for these larger, when you're sneezing, when you're coughing, these larger mucus droplets, what you're transferring in the air, that's the only protection it's going to give you, or the person, there is a barrier. If you go to a counter, you have that. If somebody sneezes, it's not going to get to the person's face because you're in close contact, kind of. But for example, like you said, the American election, they have those big congresses and conference centers. If the people are standing far away, there is no meaning to those glasses because the air moves around them, and those fine particulates, aerosols, are moving around them, and they're breathing them in and out as they're speaking, especially when they're loud speaking. So really, there is no meaning to it to put those in there. Again, only there is meaningful reason if the person is close to it. So it stops those injecting those large droplets are not colliding with the person next to you when they're breathing it in, basically.
Right, that makes sense. Okay, thanks, Judith. Yeah, for kind of explaining how that works. Now, actually, kind of jumping off from what you would reference that the half-life of the virus in, say, air is 2 to 3 hours. Now, Thomas, in terms of like in wastewater, what kind of time frame would we be looking at there?
Yeah, that's an awesome question. Okay, so the question now is time frame. And so Judith, actually, when you said that, one of the neat things that we could talk about is you mentioned how long the virus is alive. By most definitions, the virus is not alive, right? And so what we run into is sort of a semantic thing. And so it's not a matter of whether it's live or not alive, it's whether it's infectious. And honestly, we're still trying to figure that out because every virus has a different amount of sort of half-life and how long it's infectious. So when we're talking about infecting an individual, the important thing is whether that viral particle is still infectious. It's intact, it can transmit the genetic information that can then infect the individual. With the project that we're working on, all we needed is evidence of the virus being there, right? And it's actually, in some ways, it's very similar to the antibody test, that rapid test that's out there now. With those rapid tests, what we're looking at the individual is not whether the individual is infectious, but whether there's an indication that the individual has been infected in the past. With the wastewater test, what we're looking for is genetic information, genetic material, not information, genetic material from the virus. And that genetic material is much more longer lived than the infectious nature of the virus. And so we in fact think that most of the wastewater is not infectious. So it's going to have pieces of the virus that have broken down, but pieces that are big enough that we can actually directly sequence them through DNA sequencing or amplify them using the conventional PCR-based test and find evidence that the virus is in the population, but not that we have viable viral particles in the wastewater. So is that a clear distinction between those two?
That is, yeah. Thank you very much, Thomas. Thank you for breaking that down. I appreciate that. And so pivoting again to Judith. Now, the one thing that does come up is looking at, say, like an open workspace or like a cubicle type thing. So you mentioned barriers, right, are getting in the way of like kind of blocking airflow. Now, what would be something that people need to take into consideration for, those open concept workspaces, or how do you kind of design for that?
So with the open concept, basically nowadays everybody wearing the surgical mask, for example. So when you sneeze and you cough, that mask will pick up the larger particulates, will attach itself to the fabric. But again, the smaller very tiny microparticulate sizes are escaping, because these are not sealed units, and the efficiency factor is not very high on them. So when you have an open piece environment, again, the key control would be the ventilation. How do you control the air movement? Where is it coming in? Is it coming on the side door? Where does it exit? How do I set up my chairs that I'm not concentrating my tables at the exit side of the room? I'm going to concentrate them at the front side where the fresh air is entering. Therefore, most of my people will be exposed to the fresh air continuously, and the air exchange is going back in the back of the room. So for something like that, again, as I mentioned it, increase the air exchange in a room. Instead of having 2 to 3, which is a international standards for office buildings and homes, increase it to 6, 10 times, as high as you could go with your existing unit. Try to increase it. And also you could bring in a combination of those portable units I talked about it, to get rid of those viral materials in the air that it's attached itself to different, I just call them dust particles just because this is a simple way to explain it, and they float around you. So you could, yes, definitely work safely in an open environment. The key is the air, and also not to overload those environments, because obviously if you have several sick people in a smaller space, your risk is increasing because you have more viral materials in the air. So you got to control it by numbers, how many people in there, so reducing their concentration if you have less people in there, and also increasing your flow of air. So now you're diluting this material that's floating around the people.
Understood. Okay, that makes a lot of sense, I think. Yeah, to me, and I'm sure to the audience as well. So thanks, Judith. And so kind of tying on, so we talked about like number of people infected, and this actually kind of gets back into what kind of Thomas was referring to, and also with we've got what we like the actual infectious virus and genetic material. Is there any way to tell like how many, in a catchment area, like how many people like are infected from pulling this genetic material out of the wastewater, or to get an idea of it?
Yeah, that's a really great question. So can we actually, is it a yes/no test, or is it a yes and this is the information kind of test? And that's honestly one of the things that we need to figure out. So the testing right now is based on a yes/no test, but it's done individual by individual. What we're looking at is a test that's going to be done on a catchment basis, and we do think that we can actually quantify it. And so the way that we'll be looking for the genetic material, we can quantify the amount of the genetic material that's there. What we don't necessarily know ahead of time, and one of the things we'll have to figure out, is how do we standardize that? And so you can imagine it's simply a concentration and a curve, and you're going to be comparing the amount of virus that you find here with some sort of standard. We don't have a standard. It's not like we've been through a pandemic before to say, okay, well, at this stage in the pandemic, we know that we have this amount of infection. So we'll be trying to figure that out as we go through. So there's absolutely a correlation between the amount of virus that we detect and the number of individuals that are infected, but how we standardize that curve is one of the things that we will be exploring. What we can do, in addition to the amount of material that's there, is we can look at the amount of diversity that's there. And so I touched on this, but I don't think I explained it very thoroughly. Each of us as an individual have our own genetic makeup, all right? And so there are about 6 billion pieces of information in any one of us. Between the three of us, between any sort of pairwise comparison of the two of us, there are 6 million differences, right? Which is a lot of genetic difference, but that's why it does simple things like male and female, and really complicated things like social whatever. So the viruses have the same kind of diversity. They're much smaller. There's a lot less genetic material in a virus, but 2 viral particles are going to be slightly different, all right, just through mutations, through change, through time. And so because we're actually sequencing the virus, not just saying whether the virus is present or absent, we can say not only is the virus present, but we have this many different forms of the virus, right? And that does 2 things. So I mentioned we may be able to say source of the infection. And so the virus that is infecting Boston, say, for example, will likely have a slightly different sequence than the virus that's infecting Los Angeles. And I'm totally making this up, but the concept is the same. So when we look globally across viruses, there's slight differences in the virus. And we've used this in the past. And so when HIV was spreading through the community, there was a lot of work trying to identify where the spread was coming from. And we did that by looking for very small changes in the HIV virus, and we could find individuals that had unique forms. The COVID virus is exactly the same. There are small differences. And so we can use those differences in a couple of ways. We can use them to identify potential sources of the contamination, but we can also use them as potentially ways to quantify the number of individuals. So the more diversity we see in the viral sequences, the more individuals that have been infected, or at least the more different sources of infection for those individuals. Okay, I'm looking over the comments on the sidebar. I mean, essentially, it's the same kind of thing. So because we're sequencing the RNA of the virus, that gives us information that's not present in the current test, and potentially allows us to really do some more fine-scale resolution of the breadth and depth of the viral infection and the source of those potential infectious events.
Thank you, Thomas. Wow, and it's, I mean, it's a very serious topic, but also just the fact that this is, the cutting edge of this science, and the fact that it's still setting standards of figuring it out. That is, it is very interesting and insightful that it's, this cutting edge of helping us, keeping us safe. And so actually just a more practical question for you, Judit. So say I'm a small business owner or small workplace, what are things, if you had a couple tips, if I want to go out and pick up a portable air filter, or a portable so what do I want to look for if I'm going to the store to buy something like that?
So first of all, what is the specifications? So I mean, specification, what you want, what is the output, how much air is actually gonna able to clean for you in your room. So first thing you would do, actually measure your volume, your area, what size of your room you have, and then when you go out, you already know this is the size of a room, the air volume I need to clean. And then you would have that number to provide to whoever you're buying it to. So what is the output? How quickly is going to change that air for me? Is going to change it in 5 minutes, or is it 2-hour time? So obviously higher the quicker is better for you. You're going to look at what kind of filters is on it. So the higher efficient the filter, the more smaller particulates this actually filters out. So you would want to go, because we're looking here now very, very tiny particulates. You want to go to highest level. So number 13 is very high, but there is different specification. You could look for that, but what you want is this finest particulate filtration. There's another thing you might want to look at, especially as a work area, the noise factor. These are running machines that is buzzing continuously, so you want to make sure you're not, it's nice if it's a nice quiet humming noise, like a white noise, kind of zone you out. But when you have a big fan, it's going like brr, brr, brr around you, you don't want to introduce that to a work environment. So these units will come with tell you how many decibels is the running rate on these units. And then, of course, if you really want to get into details, the size, do I have room have a unit like that? Can I put that someplace? And then you could also look at where is the air coming out? So, for example, again, size-wise, can I have the air going outside, or can I channel it outside, or can I just, back into the room? But the most two important specification, the filtration efficiency. So how small are the particulates it filters out, and what is the output, the volume of air it actually could filter through a given time. So you could adjust it to your room size.
Thanks, Judith. That is very useful advice. And I think we are almost out of time, unfortunately. I have so many more questions that I wish I could ask both of you right now, and I know our viewers do too. So instead, though, I will have to thank both of you very much for taking the time to be with us today. Judit Nelson and Dr. Thomas Merritt, we appreciate this. Thank you for sharing your expertise on kind of managing the flow in the workplace, whether that be wastewater flow or airflow. That was very insightful and very fascinating. So thank you very much to both of you. And so we encourage everyone to tune in again next week at 12:15, where we'll talk part 3 of CROSH COVID Conversations, in which we'll be discussing breaking the chain of infection with the workplace, and that'll be with Dr. Sandra Dorman and Eric Kinkar. So thank you everyone for tuning in, and thank you very much to our panelists. We wish everyone a very nice Thursday, and stay safe and stay well. Thank you very much.
It's great to be here.
Bye.
Thanks a lot.
Bye. Thank you.
Thank you.